Good morning, everyone. My name is Ken Levinson with WITA. We're just going to let the attendees enter the chat room, the attendees room. Well, before we get started, if you'll just give us a moment, we'll get this webinar started. Thank you for joining us today. Good morning from Bethesda, Maryland, just outside of Washington, D.C. My name is Ken Levinson. I'm the Executive Director of WITA. We hope you are all well, and we're glad to be with you virtually today. This is our fourth webinar discussing COVID-19 and trade. As we settle into this extended period of physical distancing, we'll continue to try to do these webinars every Thursday at 11 a.m., both to inform the larger trade community about these critical issues, but also to continue to be a place where the trade community can gather virtually until we can meet again in person. Next Thursday, April 23rd, we plan to look at the shortcomings in global healthcare supply chains and how trade policy might respond post-COVID-19. You should have seen registration information in the email we sent out this morning. In the coming days, we're also going to be announcing several upcoming webinars, including a discussion with Congressman Brad Schneider, as we try to restart discussions about other trade issues that are not solely focused on COVID-19, such as implementation of USMCA and important issues such as trade and the environment, which WITA was planning to look at this year, but got sidetracked as we are having these COVID-19 discussions. For today's session, if you're having any trouble with your connection, you can always go to WITA's YouTube stream where you can watch this event live. After the panelists' remarks, we'll have a brief discussion. We'll try to answer some audience questions. If you're watching this on Zoom, you'll have the ability to ask questions using the Q&A box at the bottom of your screen. With over 400 people on this webinar, we're unable to have all of you on live audio and video, but we will try to get to as many questions as we can. We're delighted today to be joined by an amazing panel, including my co-host in this series of webinars, Wendy Cutler, the Vice President of the Asia Society Policy Institute. Today, we'll also be joined by three fantastic guests, including my good friend, Ambassador Rufus Yerxa, the President of the National Foreign Trade Council, Ambassador Ashok Nurpuri, Singapore's Ambassador to the United States, and Professor Simon Evanet of the University of St. Gallen in Switzerland. All three have been guests of WITA in the past, and those of you watching on Zoom should have all received an email this morning with the biographies of our guests today in today's event program. As I mentioned, after the panelists' remarks and any discussion among the panelists, we'll turn to questions. With that, I'd like to turn it over to my co-convener in this series of events, Wendy Cutler.
Well, thanks, Ken. This is our fourth webinar in this series. Over the past few weeks, we've really looked at a range of different issues, including the role of the WTO, the role of the G20, the OECD, in terms of responding to the challenges presented by the coronavirus and the associated economic fallout. Last week, we were pleased to get the European perspective with Sabine Wayan from the European Commission. And this week, we're delighted to have Ambassador Nurpuri with us, who will share with us the Asian perspective. And we're thrilled to welcome back Simon Evanet, who's been doing yeoman's task in tracking export restrictions around the world, and my close friend and mentor and a close friend to WITA and everyone in the trade community in Washington, Rufus Yerxa. Just a couple of developments over the past week in this space, none of it particularly good or encouraging, but it's my job to share this information. Number one, the IMF has released its GDP forecast for this year and next year. And let's just say the news is not good. They are forecasting that global GDP will decline by 3% in 2020. And that holds for most individual countries, including the US, Japan, Europe, Singapore, Malaysia, Thailand. They predict for China a GDP increase of 1.2%, but that's significantly lower than the 6.1% that they achieved last year. And of course, this news follows the WTO forecasts from last week on what will happen to trade in this year, where the WTO is forecasting a decline in trade between the range of 13% and 32%. Also, China released its March trade data earlier this week. Their exports in March were down by 6.6%, their imports down by 0.9%, showing that they're by no means out of the woods, particularly as European and the US demand will be contracting in the coming months. Finally, I'd just also add that later, well, tomorrow China time, tonight our time, China will be issuing its first quarter GDP, and almost everyone's predicting it will be in negative territory, which will be the first time apparently since 1976. And how low that contraction will be, the range is apparently between 3% and 16%. So we'll have to see. And all of this, amid all of this, this week, the ASEAN leaders held a virtual meeting, and the ASEAN leaders also met with the +3 group, China, Japan, and Korea. So I'm now going to quickly turn to our featured guest, Ambassador Mapuri, and just ask him if he can share with us the developments with respect to these ASEAN meetings. What came out of these meetings? How did they address the challenges presented by COVID-19? And because this is a trade group, if you can just let us know, did they say anything about RCEP, which was before the virus was supposed to be signed by the end of the year? Also, we would welcome your perspective on what's going on in Singapore now with respect to COVID. Singapore was the model country in terms of quickly and effectively addressing the pandemic. And we understand now there's some recent spikes which have led to another partial shutdown. And then I would just ask you, being from Singapore, a country that's so dependent on trade and such a hub for trade in Asia, what are your biggest concerns going forward as you look at what's going on to supply chains in the region? Thank you. Over to you.
Thank you, Wendy. Thank you, Ken. And thank you for inviting me to join this webinar with my colleagues from around the world. Given that this is a global pandemic, it's good that we're able to pull together from around the world to share their perspectives as we look ahead and really try and plan some sort of roadmap, even as countries deal with the current health crisis and have to deal with the urgency of this health crisis, really try to anticipate what we need to do, what we have to keep doing together as a group to make sure the supply chains, the trade routes remain very open. I'll address the 3 points that you raised, Wendy. First, what's happening in Singapore with the COVID-19, and then a little bit about the economic impact, and then how the Asia Pacific region is responding to the current crisis and the recent meetings that the leaders had this week virtually as ASEAN and the ASEAN +3. Now, Singapore, being very highly connected as an air hub, became one of the first countries to encounter COVID. In January, we had our first imported case on 23rd of January, and we started to put in place a significant number of measures to contain this initial wave of imported cases through containment, mitigation, contact tracing. Singapore and a number of other Asian countries had gone through SARS in 2003, and we were already in some cases prepared to deal with this sort of pandemic coming in. And so we had that preparatory framework in place. The Institute of Infectious Disease was ready to deal with these issues, and we managed to keep our curve relatively flat at that time. As you said, we've gone into a second and maybe third phase subsequently since January. There was a wave in early March as Singaporeans that were traveling around the world, students who were studying from around the world started to come home, schools shut down, and with no prospect of universities reopening till the fall semester, a large number of students did start coming home and travelers overseas. That was a large number of imported cases coming into Singapore. And then having managed that, we're now having a third wave over the past week or 10 days or so, where we've seen another significant increase, particularly among foreign workers living in Singapore, and a large number of local unlinked cases. That's led the government to put in place a new lockdown 10 days ago, putting in place new advisories about wearing masks as people leave their homes, making sure there's much more aggressive testing. So the basic thing that Singapore does, and even as we go through these waves, and it is not unanticipated waves, we knew that having dealt adequately with the first wave, there will be subsequent waves. And it's important to think about this as countries start reopening the economy, that this is something we're going to have to deal with. So it's putting in place of how do you manage how do you reduce importation of cases through border control measures, through travel advisories, and how do you detect and isolate cases early? What do you need to do? In Singapore, we've got very active temperature screening, health checks, swabbing at all the checkpoints, and sending potential cases directly into the hospitals for further follow-up. We've stepped up our COVID-19 testing, doing a significant number of tests every day. And once a case is confirmed, there's very active contact tracing and quarantining close contacts as soon as possible. We've launched an app called Trace Together. Our GovTech unit put that out. It uses the phone's Bluetooth to draw a map of people you may have been in close proximity with over the past 14 days. If someone that you know contracts COVID-19, it will alert you that you may have been in contact with that person. Because of the privacy concerns around this, we've released this protocol to make the source code publicly available. And we're careful to ensure that the user privacy is safeguarded and users remain in control of their data. This Trace Together app has received a significant amount of positive attention, and more than 50 countries have started looking at it. We are working with Apple and Google to develop this contact tracing into cross-border. The other aspect of this, beyond just the contact tracing and controlling imported cases, is emphasizing social responsibility and good personal hygiene. I think a large number of countries have been doing that. We put this new circuit breaker in place on the 17th of April and starting to enforce safe distancing measures. Now, this social responsibility and social distancing does come with a significant amount of impact on the economy, because in order to stop the transmission, that's where we're starting to find that the economy starts slowing down. So even as we are dealing with this, the current wave of cases, we have to put a brake on transmissions and allow the health system to recuperate. We've also had to deal now with the economic impact of this. And in many ways, this is much worse than the global financial crisis more than 10 years ago. And we presume that the pandemic will continue through the rest of this year, and countries and governments will have to deal with these outcomes. We've been feeling the full effect of this. As I mentioned at the start, we're an aviation hub, and our aviation is entirely international. And because of the extensive border controls around the region, our aviation sector has been shut down. Singapore Airlines, which has a fleet of over 200 aircraft, only has 10 remaining in operation. And they may have to even reduce these as more border controls and travel restrictions are in place. Aside from the aviation sector, tourism, retail, F&B have been very badly hit as people do not travel around. Aggregate demand has gone down. And with the disruption of economic activity, as you put in place social distancing, the manufacturing and wholesale trade sectors are also slowing down. So our GDP forecasts are negative for the year. The numbers range from -1 to -4. We haven't quite seen the first quarter numbers yet. And in order to preserve jobs, the government has put in place several stimulus measures totaling over 10% of GDP. These are meant, like in most countries at this stage, to help those most hardest hit by the pandemic and to strengthen economic and social resilience and ensure that we can keep supply chains open at this time. Even in the fact that our neighbors, Malaysia, has put in place a movement control order that impacted the number of Malaysians coming to work in Singapore on a daily basis. So we've had to work with them bilaterally to deal with some of these concerns that we had over movement of people. And I think what COVID-19 really is for countries like Singapore and around the world is a wake-up call about greater resilience, about diversification of economic structures and supply chains, and also talking about digitalization and new business models that we'll have to start thinking about. We were already pressing ahead on digitalization. We may have to move a lot quicker. in order to deal with this. Now, in Asia, the region has been responding through a number of initiatives. Singapore, New Zealand, Australia, and a number of countries have released a joint ministerial statement that affirms our commitment to uphold trade connectivity under these challenging circumstances. These are 9 countries that have signed on to this. Additionally, Singapore and New Zealand earlier this week signed a declaration on trade and essential goods for combating the COVID-19 pandemic, a follow-up on the joint ministerial statement, which invites other WTO members to join this to minimize disruption to cross-border trade. This declaration on trade will eliminate customs duties for essential medical, hygiene, and pharmaceutical products. It refrains from export restrictions and expedites the movement of essential items through airports and seaports. And we would like to see additional such initiatives as well. Within ASEAN, the ASEAN leaders spoke earlier this week, and the key areas that we want to do within the region is really continue to share information, share strategies and the experiences and technologies that all countries have to deal with this, cooperate among ASEAN countries on the areas that need to be handled with repatriation of citizens. And because technology is so important, build on the ASEAN Smart Cities Network that was in place 2 years ago to share best practices. With the +3 countries, we spoke about keeping trading routes open, supply lines open to preserve this supply chain connectivity, to ensure this unimpeded flow of goods and services. And looking ahead, and because you asked about RCEP, the Singapore Prime Minister still say we should aim to sign RCEP this year. It's more or less in place, and we want to make sure that we don't lose focus on long-term priorities as we deal with the immediate crisis. The Prime Minister said also we should pursue the comprehensive air transport agreement with the EU that ASEAN's been trying to do. So while we deal with the current crisis, I think it's important that we look ahead and make sure that our economies are better prepared to deal with this in the future. There's a certain resilience in place, and we can respond much more collectively and effectively in the future. Thank you.
Well, thank you very much. You shared a lot with us in a short period of time. We appreciate that. Simon, if I can now turn to you, I think it was about 3 weeks ago you joined us, and at that time there were about 70 countries that had export restrictions. I hear that number may have grown, and if we would appreciate you sharing with us your latest statistics, not only on medical equipment, but also what's going on in the food area, and should we be concerned with respect to growing restrictions with respect to food exports. I would also ask you how you would rate transparency efforts by the WTO, the WCO, and other international organizations in this space. And finally, just a question on what's going on in China now with export restrictions of personal protective equipment. It seems that after China shipped some faulty shipments, particularly to Europe, they have now imposed higher quality controls and certification procedures. And it looks like this new regime is really delaying shipments and holding things up at the border. And I would just be interested in your views on what you can tell us about that type of restriction, which seems that it had a good intention, but maybe now harming the ability to get out so much important PPE throughout the world. Thank you.
Thank you, Wendy, and it's great to be back. I will summarize in each of the areas you mentioned the key findings and then try and interpret them for you. So let me start with export curbs on medicines, medical products, and medical supplies. Since the beginning of this year, 75 governments have implemented 106 steps which curb exports of these products. Let me interpret those numbers for you. This month, we've seen 14 new curbs put in place, which is a significant slowdown from the 72 which were put in place last month. So this now at some level that's not quite such good news, because after all, many of the curbs which could have been put in place were put in place last month. But this month we've seen 14 more. And since the last G20 meeting of trade ministers on the 30th of March, 5 G20 countries have introduced new curbs as well. When you turn this around and ask what are the countries which are left which can supply medical equipment and alike, unimpeded, well, we have Australia, Canada, Japan, and Mexico are the ones which appear not to have put in place restrictions on their domestic manufacturers shipping goods abroad. So that limits substantially the number of countries which can supply the net importers of the world, or the sole importers of the world of medical equipment. And in that regard, yesterday, the Inter-American Development Bank calculated that as far as Latin America and the Caribbean are concerned, 68% of their imports of medical supplies and equipment came from China, the EU, and the USA, all of which now have some type of export curb. So this suggests that the supplies are really drying up on global markets, in particular for certain parts of the world. So those are the developments we've seen in the export curbs. The second area I'd like to summarize for you are the changes in import policies towards medical equipment, medical supplies, and medicines. And here, the headline finding is that 79 governments have taken a total of 52 liberalizing measures to improve the importation, or to ease the importation of these needed medical items. Of the 52 measures, 9 were non-tariff barriers, which have been liberalized. So these are often trade facilitation measures. And the remaining involve tariff reductions, and actually mainly tariff eliminations. Sometimes some countries have gone further and have eliminated sales taxes or value-added taxes on top of the tariffs. So we do see a large number of countries actually liberalizing trade policy as well. One part of the world where we're not seeing much tariff liberalization or import liberalization is Africa, and this might be a concern. There are some African countries which have liberalized, but not many. And one wonders whether or not that has to do with the loss of potential tariff revenue. And in this respect, I ran the numbers, and for the least developed countries, if they were to liberalize their tariffs on medical supplies, they would lose about 100 million in tariff revenues in total, which is not that much. And for the non-G20 developing countries, the total revenue losses are $1.9 billion. So those sums are a drop in the bucket compared to the amount of money being spent on stimulus packages around the world. And it does raise the question whether we could have an aid for trade package, which would help encourage countries to liberalize their imports in these medical products, especially those who are worried about revenue considerations. Turning now to food exports and curbs there, by my count, and I see it's almost confirmed by that of the International Trade Center in Geneva, less than 25 governments have put in place curbs on food exports. There are some big players who have put in place curbs on some certain items, like Russia on wheat, and that is a potential concern. But if you put the developments in that area in perspective, I think you'll see that we're nowhere near the situation we were in 2008 and 9, when we had a substantial number of export curbs introduced at that time. I dug up the numbers there, and according to the FAO, there were 33 nations during that period put in place 87 export restrictions, and we're well below that total at the moment. And if you go product by product and look at which countries introduced measures back then, they include many of the bigger players who have not yet moved at this time. So that suggests then that the food curbs the export curbs in food are less of a problem or less pervasive than the export curbs in medicine. But of course, it doesn't have to stay like this. This is something we have to monitor. It could develop and get worse. And I noticed there's been a lot of interesting commentary in the last week about what will happen in North America and Western Europe when it comes to the harvesting seasons. Many of the people who harvest crops in those regions come from abroad, and they, of course, will no longer be possible for them to be able to move and travel to the farms where they're going to be harvesting food. So questions of food scarcity may well arise in the next few months, and that may well change the picture on food export curbs. You asked me to address the question of transparency and notifications. Here, there are 3 international organizations which are at work. The WTO has been publishing the notifications that it receives from member governments. And here, I think the bottleneck is the governments. I want to emphasize that, not the WTO Secretariat. There are 51 notifications which have been published as of this morning. And in the area of export restraints and alike, there is the number published on the WTO website is a small fraction of the number that others have counted, including myself and my team. So I think there's a long way to go before governments are willing to fess up to their curbs on needed medical supplies. Another organization which has been doing yeoman's work is the World Customs Organization, which has been publishing the regulations associated with export restraints. They've published, on my count, I think was 47 of the legal texts. It's important to understand when you interpret the WCO's numbers, they only publish information on formal de facto export curbs or export bans. So if governments use backdoor ways of doing it, as some have, that will not be found on the WCO's website, but still a lot of useful information is there. And the last organization which has made attempts to document what governments are doing is the International Trade Center, and they have documented 23 countries curbing exports on food, and around the same number as us on documenting export curbs on medicines. They have a lot there. They don't always have the underlying data, the underlying sources like the WCO, but their database is quite extensive as well. So I think what we're beginning to see.
Quick comments on China before I turn to Rufus.
Sure, sorry. I was just going to say, I think the international organizations are catching up. So you quickly asked me about the Chinese measure. As far as the Chinese measure is concerned, given the huge number of new producers in China of medical equipment, there have to be concerns about safety or about the proper production of various pieces of medical equipment. So I'm not surprised that there's a bit of a regulatory response on the Chinese side, but everything, of course, the devil is in the details on how this gets implemented. And if this becomes a strategic tool to limit exports to different destinations, then indeed it would be problematic. Thank you very much.
Wendy, you're muted.
Sorry. Now I turn to Rufus. I'll be quick with my question. I think it'd be useful for us if you could offer the U.S. business perspective. Obviously, U.S. businesses have a lot on their mind. Trade is part of what's on their mind, but there's a lot of other things rightfully on their mind as well. But when it comes to trade, what are immediate concerns? What is the U.S. business community looking for in the international climate, particularly with respect to supply chains? And then maybe you can just offer some views on what are the longer term implications for policies for the WTO and which issues might become more important. I mean, Ashok already mentioned the importance of digital trade. Is that something where you think that coming out of this crisis, we might see a new focus and appreciation for rules in the digital area?
Sure. Well, thank you very much, Wendy. And let me just pay compliments to you, Ken, and you, Wendy, to WITA and to the Asia Society Policy Institute for really this fantastic effort at keeping the trade community in contact and working on these issues. And NFTC wants to be a full participant in that, and we appreciate this opportunity. I think it is useful to separate the various tariff and supply chain issues, the policy challenges, the economic impacts, and other things into a sort of a short-term and longer-term analysis, as Wendy just asked me to do. You know, short-term, clearly now the big question is, what are the imperatives driven by this pandemic? That is, in terms of trade policy, as with every other policy, the interest in dealing effectively with a pandemic outweighs almost any other traditional policy objectives. And even where there are conflicts between some longer term, let's say, objective to, to correct unfair trade practices or something else, the pandemic really takes precedence over them for the time being, and talk a minute about that. Longer term, the question becomes, how are we going to maximize our ability to recover economically from what is a devastating economic impact, and to ensure we're better prepared for future crises of this nature. And it seems to me there's some trade policy implications on both of those questions. In the short term, I think it's pretty easy. I mean, Simon obviously outlined a lot of the measures that countries are adopting, but I think the reality is that most of us would agree that this is not really the time to end up implementing policies that disrupt supplies, particularly in the two critical areas, medical and food. You know, these are the things that publics all over the world, including our own publics, are going to need to survive this pandemic. And we need to maintain the system of supply chains the way it exists today, not use the crisis to enact restrictive measures or those that we think are going to somehow preserve our ability to deal with it domestically, like an export restraint, or those designed to reshape production to make us self-sufficient, like tariffs or binational restrictions. Why are those policies so bad? It's pretty simple, because they ultimately end up being highly disruptive to everyone if all countries go down this road. It just is, you know, it's a self-defeating strategy. It disrupts the supply chains in the short term. It stops global coordination, and it increases the suspicion among state players that, you know, if anything accelerates their sort of go-it-alone approach. And just in practical terms, for a country like the U.S., it's a dumb idea, because we're 5 times as much, we're 5 times more dependent on imports than on domestic supply currently for protective clothing. Just as an example, when you get in areas like drugs and medicines, global co-production is very complex. We need to ship active ingredients because of, you know, everything from intellectual property to tax systems these supply chains have developed, and we can't just simply change them on a dime. So I know it's politically alluring for governments and politicians to say, oh my God, we're exporting some of these things when we have a shortage in our own hospitals. But almost always rapid reactions by a number of countries to that, rather than coordinated reactions and discussion, will inevitably end up hurting more than they will help. And the better approach, obviously, is to maximize coordination and try to ensure stability. So that's the short term, and I don't think I'm saying anything that people haven't already thought about or heard. Longer term, you know, the bigger concern coming out of all of this is that we will have worldwide production and services devastated. Every economy in the world is going to be on its backside. And there will obviously be a huge temptation of governments and politicians to adopt highly nationalistic economic policies in the vain hope that this will somehow restore their health. Of course, we all know from prior history that it doesn't really work that way. But there will be an overwhelming tendency, I think, to look at things like industrial subsidy policies and higher tariffs. In fact, with treasuries around the world exhausted, it may be even more desirable from their point of view politically to go the tariff route than the subsidy route. Both are going to be problematic, and they're going to be things that we're going to have to deal with in the system going forward. And that's why it's going to be really important to have some kind of functioning international trading system able to credibly deter this. And I think US leadership in alliance with other major players is going to be critical. But I am very concerned that because of the clear animosity of this administration to the WTO, it will be difficult for us to be seen by the rest of the world as leaders. I mean, just yesterday, I heard the president making statements once again, sort of scolding the WTO for not treating us well, rather than sort of lifting people up by talking about the importance of all working together. You know, I was at the WTO in the aftermath of the 2008 financial crisis, and I saw the pivotal role that our leadership and the leadership of a number of other key countries played in really deterring bad actors in adopting a lot of those kinds of measures. And so I think, unfortunately, I think it'll now be a massive effort to restore US credibility in leading that fight. But I think it'll be necessary. And we can talk about what the US can do longer term. A lot of it will be already in the existing rules of the system on things like tariffs and other non-tariff measures that we just simply have to force. But clearly there are areas like the negotiation going on the digital economy, on e-commerce. What better demonstration, as tragic as this event is, it certainly is demonstrating why governments should take a more positive and open attitude towards an effectively functioning global digital economy with a more open architecture than with nationalistic kinds of restrictions. So I think that's promising. But there is the second part of this, beyond what we can do to help create stability and avoid protectionism in the recovery phase. What about longer term in being better prepared in the future? There's a lot of things trade can do there. If you think about it, what will the challenges be? First of all, we better have better global stockpiles of these kinds of necessary tools to fight a pandemic. And it seems to me some kind of international cooperation, maybe even an international agreement going towards global stockpiling of necessary supplies, ventilators, protective equipment, vaccines, testing equipment, a whole bunch of other things. And if you think about the effort that's going to be needed globally just to vaccinate 9 billion people, let alone have enough protective clothing for hospital workers all over the world, there is, I think, a potentially very good future template for that should be worked on in the context of an organization like the WTO working with the WHO and others. I'll leave it at that for now, Wendy. Obviously, we can pursue this in further discussion.
Okay, Ken, why don't I turn it over to you and you can let our audience ask the remaining questions.
Yeah, thanks, Wendy. Thank you to our speakers for your opening interventions. As I mentioned previously, to submit questions for us to try to get to on this webinar, please use the Q&A tab on the bottom of your screen. Based on our experience in the past weeks, it would be most helpful if you kept the question short, 1 or 2 sentences, and if you can identify who the question is directed towards. For the first one, we'll go to Ambassador Murpuri. The question comes in: Singapore is a manufacturer of PPE and COVID-19 test kits. Is there any concern that with an increase in cases in Singapore, export bans may be imposed on domestic exporters?
Thank you, Ken, and thank you for the question. No, we have not put in place any export controls, but let me just share with you what happens when you do manufacture PPE and COVID-19 test kits in Singapore. There's a whole supply chain to this. Even the fact that we can do these masks in Singapore, the PPE equipment that we can do to supply kits, they require chemicals that come from around the world. So it's the beggar thy neighbor approach of closing off your exports means that others will close off their exports to you as well. So Singapore has not put in place export controls. We rely on open export supply chains to make sure that supplies come to Singapore, that we can manufacture these products. And these products, some of course will be used in Singapore, but many will also go out and go into the international market. I think that's the importance of the interdependence of trade and why we need to sort of think in terms of this longer term supply chain, that not each country can remain dependent on itself. And I'm taking up one of Rufus's points about going ahead. What do we do when we create a global sort of supply that we can reach into? And we have to think of some of these areas. You know, before the COVID-19 crisis, globalization was also already under some pressure. Sort of populist moves had people questioning about trade and globalization. as we come out of this, I think there will be new challenges of globalization. And I think it is important that those of us engaged in trade, those of us who've seen the benefit of globalization, that understand that these supply chains support all of us. Yes, we may adjust some supply chains, we may shorten some supply chains, but the efficiencies that we get out is we should not lose that because we're stepping into a world in which we're putting in place controls. So no, Singapore is not putting controls in place because we are dependent as well on supplies coming into Singapore. Thank you.
Thank you, Mr. Ambassador. Wendy, I know you're our moderator today, but you're also an expert in so many of these issues. We rely on you for your insights, especially on a lot of issues related to China and East Asia. We had a question come in about a recent piece in the Wall Street Journal about stranded medical supply shipments in China. Do you know if that's due to any export restraints or retaliatory measures, or if it has to do with some of the things Simon was talking about with doing a better job of standards testing for Chinese exports?
Well, that's why I asked Simon the question, because I think the jury is out. If in reading the article this morning, it definitely suggested that maybe what started as an issue of quality control, and I think Simon made a really good point why quality control was absolutely needed in China, because countries like the Netherlands and Spain were sending faulty PPE back to China. But have these restrictions now turned into something more nefarious? And are they being used kind of as a disguised restriction, particularly against exports to the US? Because the report suggested that that a number of the shipments that were held at the border under the guise of needing more documentation, certification, were from US companies. It's too early to say. I hope that's not the case, because I think, as Ashok and Rufus have said, having global supply chains right now in these products is essential. It's critical. If countries over the longer term, they should take a look at these supply chains in these critical products and make the decisions they need to make. But right now, it doesn't help anyone if countries are holding up these products.
If I may, thank you, Wendy, for that. Simon, going to turn back to you. You may have seen there was news about a meatpacking facility in the United States, Smithfield, in South Dakota, that had to shut down, and I believe they may be owned by the Chinese entities, but I don't know if that's even material to the question, which is they had to shut it down, and it's about 5% of U.S. pork supplies. I believe I saw that number. Are you hearing about any countries that have any shortages of food or concerns about that? And if there are any countries taking any measures to assure the food supply?
So thank you, Ken. I have tried to read into this quite carefully, because it doesn't make much sense to have export curbs on food unless there are food shortages. And I think it's a fair assessment of expert opinion that at the moment worldwide, we are not seeing big shortages of food. Quite the opposite. There some degree of surpluses. So it's a little bit hard to understand why some countries are rushing in this direction. And it's interesting to note that in some countries like Vietnam, where there was a rush to put a ban on the exportation of rice, very quickly the rice farmers made their objections known to the government, and the government has scaled back that particular measure. Romania is going through a similar dynamic at the moment. So I suspect that what's happening is that some governments are overreacting and putting in place export bans on foods, and they're getting pushback from producer interests. They're looking at the situation again and realizing, wait a minute, maybe the situation isn't as bad as it appears. So I think we're in the overreaction phase at the moment. But please, I want to just note what I said earlier. We're in early days here. Once we get into the picking seasons in Western Europe, North America, if we don't have those foreign laborers coming in to be able to pick those crops, then we're going to lose a lot of produce. And so food scarcity, if not necessarily shortages, may well come back in a couple of months as an issue in more countries. So we should keep watching this.
Thank you, Simon. It's an important issue, and I think it might even warrant an entire session by on this issue in the next couple of weeks. Especially the issue you raised about guest workers. I was mentioning to you about a friend of mine who has family in Switzerland, and she can't get from the United States to Switzerland to see her family. I've got another friend who's been in New Zealand, an American, who can't get back to the United States. That's not the hundreds and thousands of guest workers who I know in the United States relies on for its crops in the picking season. So big issue, Wendy, for us to look at maybe at one of our next upcoming sessions. Try to get ahead of that. Coming back to Ambassador Yerkes, Rufus, the United States has withheld resources, it's saying, from the World Health Organization. There's obviously concerns about that have been going on with the WTO and U.S. Concerns about long-term at the WTO. Do you see we've seen sort of a battle between federalism and states in recent days and weeks about shutdowns and reopenings. Is there a role for states to play in establishing some of these trading relationships directly with other countries when they're not able to get the federal government potentially to make the leadership that it's needed?
Yeah, thank you, Ken. I think that it's really, to me, very worrying that we see, rather than efforts to increase cooperation and overcome, differences through greater coordination at all levels, the global level, the federal level, and the level between the states. I think, things like deciding you're going to withhold funding from the WHO is just exactly the wrong signal to be sending about cooperation at this time. I saw a doctor on TV yesterday likening it to the emergency room doctor who decides he's not going to treat an auto accident victim because the police told him that the guy was texting at the time of the accident. So it seems to me that what we need to be doing now is focusing entirely on how to make things better, not trying to sanction prior behaviors. I think among the states, the reason a lot of them are reaching out is because, if you look at what Gavin Newsom did in California, for example, to try to get his own source of supply in China of masks, largely because there was just not a sufficient indication of coordination at the federal level. Now, I think some of that has changed since then, and I think there has been a lot of work done between the federal and state governments. But let's face it, ultimately, trade is a function both of a lot of private transactions, procurement transactions, including by states, and that was what this was in the case of California, and of course, federal overlay and federal regulations and laws. And I don't quite know how to answer your question other than to say, unless we have all of those interrelationships working effectively, states are going to go their own way. Or, this is going to end up being, instead of people cooperating with a larger game plan, they're all going to sort of, go out and try to get their own problem solved. And hopefully, we find ways of minimizing those tendencies by having much more confidence that there is both a federal plan and global coordination to prevent that kind of, every man for himself mentality.
Thanks. Thank you, Rufus. And it kind of segues right into the next question, which you may want to comment on, but also see if Ambassador McCreary wants to comment. Question coming from our good friend Sean Donnan about EU proposal for a plurilateral negotiation of trade and medical products. Of course, that builds on some of the initiatives that countries like Singapore and New Zealand have taken to keep supply chains open, that we're all very grateful for. And then some critiques that some of these things like a plurilateral agreement or some of these regional agreements could end up concentrating supply chains in some ways that actually lead to fewer countries producing or entities producing some of these products, which could lead to future global shortages potentially. So it's, as you were saying, Rufus, all these things are so connected. I wonder if either of you have comments about the EU initiative and the long-term health of these supply chains. And Rufus, your idea, of course, of a global stockpile would be one way to potentially address some of those things.
Why don't you go first, Ashok?
Thanks, Rufus. Well, I haven't looked at what the EU is proposing, but traditionally we have used agreements of this nature to keep pushing the WTO agenda forward. I think it's important that we keep any of these agreements, plurilateral, multilateral, to make sure they're consistent with the WTO. I think that's quite important. The idea of these agreements just being for a limited group of countries is not really the way that we've used bilateral and multilateral trade agreements, even within the East Asia region, within ASEAN, the ASEAN +3. We want to make sure that these are much more open to everyone. So it may be an idea we'll have to think about in terms of medical products, but we're dealing with the current emergency, but we also have to think much longer term of the global trading system and make sure the WTO is not damaged further as we deal with this new crisis. Thank you.
Thank you. I actually didn't get to tee him up yet, but Simon, I thought I'd come back to you in the area of medicines. As you've been tracking export restrictions on things like PPE and other healthcare goods, have we seen any restrictions on medicines subject to export controls?
Ken, we have seen restrictions. I suppose the country which is most high profile in this is India, which at first restricted over 20 different medicines and medical compounds. They've rolled back on some of those restrictions over time. The most high profile, of course, of these medicines is the one which I'm going to struggle to pronounce, hydroxychloroquine, which is the one which, of course, has got a lot of attention in the United States. I would say that tracking the medicine limitations is quite difficult because often governments are very imprecise about what types of medicines they are going to be curbing, which makes me wonder if there are supplies being held up at customs houses as customs officials try and interpret imprecise regulations. So I fear that the problem is actually broader than is actually stated in many of these regulations, precisely because the regulations are so non-transparent and opaque.
Thank you, Simon. That's obviously something I was mentioning about food. I think we need to get into a discussion. Another topic for another day about the pharmaceuticals issue. This question I'm going to direct towards Rufus, coming from a good friend of a lot of us, Grant Aldonis. I'm glad to know Grant is on the line. Look forward maybe to having him at one of our future discussions. Rufus, do you think as a potential the WTO discussion could take place or something on the plurilateral level, how would you see a negotiation be able to take into account the issue of these supply chains? I think that's something that you talk about exports from one country or another, and traditionally trade negotiations focus on those. There's a lot of bilateral negotiations that take place within these multilateral discussions. But how do you begin to get at the issue of the medical supply chains in a multilateral discussion? And is that something the WTO could do, sort of a supply chain round of some sort?
I think it's worth examining because, it does transcend so many other elements of the WTO system, whether it's, subsidy rules, intellectual property rules, rules of origin. By the way, my first experience working with Wendy was when she was the rule of origin negotiator in the Uruguay round. That was a little while ago, Wendy, so I won't elaborate further. You look a lot better than I do, let's put it that way. But I do think that the reality is that, we're going to need now to have some ideas about cross-cutting kinds of negotiations in the WTO system, not just, a few years ago, everybody wanted to talk about how, well, the best thing to do with the WTO now is no more future rounds. We should have specific negotiations item by item on specific subjects. And then along comes something like this, which maybe will convince us all that we need more comprehensive coherency among a lot of them. And I think the big challenges on supply chain are, we're not going to end up being a better, safer world. No country's going to end up being better and safer simply by adopting a whole bunch of, autarky type of solutions to this. We're going to need to recognize that we need global trade in a lot of these things in order to be successful. And the countries that are the most open, innovative, and interconnected will probably do better than countries that try to go the route of autarky. But they need some framework to work on. And I think coming up with ways of diversifying supply chains, not being so dependent on, China being the world's factory, but at the same time realizing you can't do it all yourself. I mean, look, what happens when the pandemic hits hardest in your country and your own industries can't produce and you're dependent on imported supply for things? You need to think in broader terms. So I think there's a lot of creative ideas that can come to the forefront here. I don't think that's going to happen immediately, however, Ken. I think it's going to take time for that to evolve. Maybe in the short term, what we need is some quick moves to reduce the costs in the existing supply chains through maybe suspension agreements on tariffs and other things. You'll see a lot of countries that are already talking about suspending tariffs, including the US. The USTR has soliciting comments on how to exempt further medical supplies from tariffs if necessary. And, a lot of our both consumers and producers are calling for those sorts of things.
Thank you. Thanks, Rufus. You're always someone I look to for wise words on these things, and I'm very grateful to have you here. I think as we enter into the last moments of this webinar, maybe a question that could be lend a tone of optimism to some extent. A question coming from a good friend of many of us as well, Mary Latimer from Mars Inc., for Ambassador Mapuri. In this crisis, have you seen any shifts in the relationships between between and among countries in the Asia-Pacific region, between ASEAN and China, China and India? Of course, we've seen the leadership shown by Singapore with countries like New Zealand as well on the healthcare crisis. Do you see any both near-term and long-term shifting in some of these relationships and leadership in the region?
Well, I'll speak about the near term because the long term, medium term is still uncertain how we emerge out of this. The region is still driven by the active presence of the United States and China. What the countries of Southeast Asia and ASEAN is good that the leaders already have very strong links. ASEAN leaders used to meet twice a year in physical summits. They were supposed to do a physical summit this month in Vietnam. They were able to translate that into a virtual summit to have conversations going. Foreign ministers have engaged virtually. Health ministers have engaged virtually. I spoke about RCEP. If we do want to have some area in which we're looking ahead, is RCEP. There was a video conference earlier this month among the RCEP chief negotiators to try and at least push through RCEP signing later this year. So while there is obviously value in physical contacts, because we have deep relationships with each other in Southeast Asia, with the ASEAN +3, with the US, there are video conferences going on. And I think that's one helpful looking ahead, that to make sure that as we look into the frameworks that we're going to work with after, as we overcome COVID-19, that we make sure we have an international framework for cooperation. I think that is important rather than one in which we're conflicting with each other and going after each other in some of these areas. So hopefully that we can keep focused in that area and keep the regions and countries connected. Thank you.
Thank you, Mr. Ambassador. And it's really admirable how well Singapore and some of its partner countries have done in being able to make decisions relatively quickly amongst each other in this time when it's so hard to stay connected. And as Wendy and Rufus know so well, negotiations are, it's nice to be able to have conversations by phone and probably video, but it's not the same thing as being able to go and have the kind of conversations you have one-on-one with our trading partners when you're in a room and can step out of a room and understand people's real agendas. I think we're going to have to wrap up, unfortunately. I know there are a lot of questions that came in, and I'm sorry we're not able to get to all of them. Thank you to everyone. Wendy, any final words for the session today?
Just thank you to our panelists and to the great audience, and sorry for the questions we didn't get to. Ken did mention we'll be continuing these series, and two of the issue areas that we've been talking about delving deeper into is the issue of food and agriculture, but also the issue of medicines and IPR. And so I would just say we would welcome suggestions from all of you on the line as well, because I think there's a lot to discuss here. And I think what Rufus said earlier is really true. Through these webinars, we are reconnecting the trade community through these times, and we're all working from home. So we do want to include you more. We welcome your suggestions, and thanks for joining us.
Thank you, Wendy. Thanks, Ambassador Mapuri. Simon, thank you for joining us again. Rufus, I'm very grateful to you as always. Wendy, thank you. Next week, we are also going to be getting into a lot more detail about supply chains, both near and far. So a topic that we spoke a good bit about today, we'll be able to dive in even more deeply, I think, next week. Thank you, everybody. Thanks for joining us today. Really grateful to have everyone here. We look forward to seeing everyone again next week. Thank you. Be safe, everyone.